Okay, good morning once again, students. Today we are coming to talk about cavernous sinus. Cavernous sinus. Remember, the word sinus means a cavity within a bone or within a structure, and cavernous is cave-like. It comes from cave. Okay, so there's one important structure within the body or in the brain known as the cavernous sinus. Cavernous sinus. You see, it is a very special area. Say that we need to talk about it. The cavernous sinus is found within a bone which is known as the sphenoid bone. The sphenoid bone, okay? And this particular bone contains the sella turcica or Turkish saddle. Sella turcica is not the Turkish saddle. It contains or houses the pituitary gland that later we are going to learn about. Okay, all right. So let's talk about the cavernous sinus. It has a roof, it has a floor, lateral border, medial border, anterior and posterior borders. So at the roof, what do we have at the roof? The roof is made up of meningeal layer of the dura mater. The floor is made up of endosteal layer of the dura mater. The lateral wall is made up of what? The meningeal layer of dura mater. The medial wall is made but the medial border is made up of the body of the sphenoid. You also have the sphenoid sinus over here. Okay. Now, so the cavernous sinus is important to know about it because the structures that it contains are of so much importance in ophthalmological practice. So, they are divided into those that cause, just before I forget, the anterior border of the sphenoid of the cavernous sinus, anterior border of the cavernous sinus. At that level, we have the superior orbital fissure. It's not represented here, but remember the superior orbital fissure is here. That constitutes the anterior border of the cavernous sinus. And the posterior border of the cavernous sinus is made up of the petrous portion of the temporal bone. Let's talk about few structures or the structures that the cavernous sinus has. At the lateral wall or the lateral border of the cavernous sinus, you have the oculomotor nerve, and inferior to it you have the trochlear nerve. Inferior to that you have the ophthalmic division of trigeminal nerve, and inferior to that you have the maxillary division of the trigeminal nerve. This is the abducent nerve or the ciscranial nerve, and the internal carotid artery. There's one particular element which runs along the same pathway with the internal carotid artery, and these are the oculosympathetic fibers from the carotid plexus. Remember, the trigeminal nerve has three major branches, namely the ophthalmic, the maxillary, and the mandibular. The mandibular does not pass through the cavernous sinus. That is why it is not found here. So, look at the various venous channels that are found here within the cavernous sinus. Okay, the various venous channels. Okay, with low flow blood within these valvulus structures. But in contrast, we have the internal carotid artery, which carries blood that runs faster and generates heat. So there's one particular specific feature of the cavernous sinus. What is it? It is the fact that that's the only part of the body where you have fast running heat generated arteries in the midst of several channels of veins, and this permits exchange of heat between the high volume transmission of blood through the internal carotid artery generates heat, and the low flow valveless venous channels that are cool in temperature. So there's exchange between the internal carotid artery here, exchange of heat, and then the low venous, the cold low flow venous channels that are found here. In future, we'll learn about the essence of this exchange of heat. So again, let's repeat the structures which the cavernous sinus contains. We have the oculomotor nerve, also known as the third cranial nerve. We have inferior to it the trochlear nerve, followed by the ophthalmic division of cranial nerve 5 or the trigeminal nerve. Then you have the maxillary division of cranial nerve 5 or trigeminal nerve. Then you have the abducent or the ciscranial nerve, a bit more towards away from the lateral wall. And then you have the internal carotid artery, which also runs the same course with the oculosympathetic fibers from the sympathetic plexus. So along the wall, the structures include the third cranial nerve, the fourth, ophthalmic nerve, maxillary nerve. But through the sinus itself proper, you have the internal carotid artery with the oculosympathetic and then the abducent nerve. So this particular picture shows us more details which is of importance to you. So as I said, the cavernous sinus is found within the sphenoid bone. The sphenoid bone contains the sella turcica. In normal translation, sella turcica is Turkish saddle, okay? Turkish saddle. So sella turcica contains very important structure in the body known as the pituitary gland. Pituitary gland, it produces a lot of hormones, okay, with hypothalamic influence. So just on top of the pituitary gland, we have the chiasma. And I told you the chiasma is a place where the left and right optic nerves they meet, okay, to give tri-dimensional view. So assuming and the distance between the optic chiasma and the pituitary gland here is 10 millimeters or 1 centimeter. So if the pituitary gland increases in size, it will impinge, press, compress the optic chiasma, and that will give the patient visual symptoms. So again, let us observe the structures that we can find within the cavernous sinus. Here you have the oculomotor nerve is here. That is the lateral wall. Okay. Now after that we talk about the structures that pass through the cavernous sinus itself. Of course, the lateral wall also contains structures that pass through it, but you should know those that run along the wall and those that run along within the sinus itself. So along the wall, you have the oculomotor nerve, the trochlear nerve. You have the ophthalmic division of trigeminal. Then you have the maxillary division of trigeminal. But remember that the abducent nerve is found here. It is not the lateral wall, but look at it over here. And you have the internal carotid artery, and which run the same course with the oculosympathetic fibers from the carotid plexus. There's something that you should know about this. Sometimes when you have cavernous sinus syndrome, if the third if the third cranial nerve is fully involved, especially the upper part, then you have full blepharoptosis. The eyelid will be totally closed, full or complete or total blepharoptosis. But If it is the oculosympathetic fibers which are more affected, remember these oculosympathetic fibers give innervation to molar muscle. A molar muscle just gives little strength so far as opening of the eyelid is concerned. So in other words, if it's the oculosympathetics which are affected, then one will have partial blepharoptosis. But if it's the third cranial nerve, especially the superior portion which is affected, then the client will come with total blepharoptosis. Okay, so there is something you should also remember. Because of anatomical proximity and the structures that these components transmit. Look, you can have the the orbital apex here. This is the orbital apex. So you can have orbital apex syndrome. You can also have the superior orbital fissure syndrome. But you can have cavernous sinus syndrome. It is important to differentiate these syndromes because the structure looks so similar. Alright, let's start one by one. Students, if you have to differentiate between orbital apex syndrome and superior orbital fissure syndrome, it is very simple. So far as the superior orbital fissure syndrome is concerned, if there is a you just concentrate on the structures that pass to the superior orbital fissure. Okay, so in superior orbital fissure syndrome, we have what? Ophthalmic division of trigeminal nerve has been affected. The trochlear nerve is affected. Oculomotor nerve is affected. Abducent nerve is affected. Oculosympathetics are affected. Of course, we can also have the superior ophthalmic vein being affected. But remember that the maxillary nerve is never affected because it does not pass through the superior orbital fissure. This is your superior orbital fissure. Okay, let me repeat the structures which pass through the superior orbital fissure. They include ophthalmic division of cranial nerve 5 or the trigeminal nerve, the trochlear nerve, oculomotor nerve, abducent nerve, oculosympathetics, okay, of course, the superior ophthalmic vein. The dimension maxillary nerve, no, because it doesn't pass through the superior orbital fissure. Now, let's talk about the orbital apex syndrome. Look, this is the optic canal. This is the optic canal, okay? This is the optic canal. So, the optic canal transmits the optic nerve. In orbital apex syndrome, apart from all the structures which we have just mentioned, which are affected because they pass through the supraorbital fissure, in addition to that, you have the optic nerve getting affected when we talk about the orbital apex syndrome. I repeat, in orbital apex syndrome, apart from all the structures which pass through the supraorbital fissure which are affected, in addition to that, you have the optic nerve being affected. So that is the orbital apex syndrome. So difference between superior orbital fissure syndrome and orbital apex syndrome is that in orbital apex syndrome, the optic nerve is affected in addition to all the structures which pass through the superior orbital fissure. But when we talk about the superior orbital fissure syndrome, the optic nerve is excluded because it is not affected, because it does not pass through the superior orbital fissure. So another difference you should notice is when we talk about cavernous sinus syndrome. Cavernous sinus syndrome. What is cavernous sinus syndrome? In fact, in cavernous sinus syndrome, oculomotor nerve is affected, the trochlear nerve is affected, ophthalmic division of trigeminal is affected, maxillary nerve, which is a second division of the trigeminal, is affected, oculosympathetics are affected, and the internal carotid artery may also be affected. Ladies and gentlemen, remember that cavernous sinus syndrome, in cavernous sinus syndrome, the maxillary nerve is affected. The maxillary nerve is what? Affected. But when you go to the orbital apex syndrome, the maxillary nerve does not pass to the orbital apex. Neither does it pass to the superior orbital fissure. So once you hear that, or you know, or you explore and realize that the maxillary nerve is affected, then most likely your syndrome it should be limited to the cavernous sinus. If the maxillary nerve is not affected, then limit your syndrome to either superior orbital fissure syndrome or orbital apex syndrome. Is the optic nerve affected? No. If the optic nerve is not affected, then we're talking about what? Superior orbital fissure syndrome. If the optic nerve is affected, then you are talking about what? The orbital apex syndrome. How do you know that the maxillary nerve has been affected? Remember, the maxillary nerve is sensory in nature. And where does it innervate? Sensation around the lower eyelid, around the maxillary region, side of nose, upper lip, upper teeth, upper gum. So these are the areas you need to explore their sensation. And if they are not intact, then you see that the maxillary nerve is affected. And I'm sure and know that you know how to explore the other cranial nerves because we've talked about them in class before. So at this particular juncture, I want to thank you for your rapt attention and urge you to continue learning very hard. Gather momentum, go through your slides, and if you have any difficulties, you can clarify them with me in class. Until I see you again, please enjoy your time and remember to learn hard. Thank you. Thank you.